Hello, this is case number 172-37934 with a history of behavior changes, breathing problems, decreased outputs, so urine and defecation, and a history of pain. And we're running SRT test number 1. I'm Dr. Carlson, and SRT equals stress resistance testing. And stress resistance is looking very similar to in a wire circuit. The more resistance in a circuit, the more heat or inflammation is going to be generated. And another simple analogy is that we got a roadway here, we have the bumper pads, and we have the ditch. So in good health, we're driving in between the lines, and we're driving a straight path. So that's good health or healing. Acute stress is if the car starts to go off the road just a little bit, we hit that bumper pad and you get that noise to alert you that we better make an adjustment to get back on the road, or we're going to go in the ditch over here. So when we hit that bumper pad, acute stress, that's going to be any number above positive 20. It says that I got a 50-50 chance I'm either going to make the correction or I'm going to go down here into chronic stress. Now, chronic stress equals dis-ease, and that can lead to disease problems. And in this case, it could lead to behavior, breathing issues, problems with going to the bathroom, or pain. And I like to use 5-element theory, and in this diagram here, we see the heart has a relationship to behavior. The stomach is down here. The lungs are right here. The kidney is right here. And the liver is right here. So the history was we ate a shrimp, so digestion. We saw a change in breathing problems. We saw a change in urine output, which it could lead to pain. So we saw pain here through the liver, and a behavior change. So you see everything is connected. So each section of the body had something to do with the symptoms that were shown. And so if we look at stress resistance, what were the things that was maybe underlying there that set it off? Because eating shrimp shouldn't affect most dogs. They should be able to eat something simple and not set off the reaction. But if we look at the underlying factors, there was approximately about 17 acute stressors. Takeaways from that were neurotransmitters, the nervous system, and the second is blossoming flowers, which would have a relationship to behavior and also to respiratory. So we add the shrimp here. We already had an issue with the nervous system. We had an issue with breathing already, potentially with the blossoming flowers. We add the catalyst, which is a piece of shrimp, and it set off this cascade of events. And so the goal of SRT is that we're going to restore normal balance by using the calibrated hemp oil at 5 drops every day for a minimum of 3 weeks, up to 3 months, and allow the body to restore itself. In the meantime, we want to control inflammation. We want to control pain. We want to help breathing. We want to reduce stress. So if we have to go to medications, hopefully we can use something more natural like herbs versus medication. But sometimes the body's under enough acute stress or discomfort that we have to use more conventional therapy. But the goal is to control discomfort. Second of all is allow the body to restore itself. And then finally is we have restoration of normal body function. So that's the goal, okay? So read through the analysis, certainly watch the video with the explanation, and then that formulates questions, so then we can set up a consult, or you can send me an email and I could do another video for you. So I appreciate you taking advantage of the video conferencing like this. It's awesome, so I can present it and you can watch it several times. Thank you.